Welcome back. Well, the reputation of Canada's long-term care homes took a hit during the pandemic, with vulnerable seniors seemingly left exposed to the virus. Even without that new light, though, the need for more and better forms of long-term care was a pressing one. As our population ages, how do we ensure enough care for those who need it? Jodi Hall is CEO of the Canadian Association of Long-Term Care. Jodi, thanks for being with us.
Thank you, Amanda, for the invitation.
So many were shocked, actually, in pandemic to see just how vulnerable seniors could be in long-term care homes. What did we learn from that? Have changes been put in place to make sure that some of what went on there couldn't happen again? Is the care better?
Yeah, so there's certainly the last few years have been incredibly difficult for long-term care. The Canadian Association for Long-Term Care and our members at the provincial level have been longtime advocates on some of these issues that we really kind of saw unfold in such a tragic way during COVID outbreaks. So things like staffing shortages, aged infrastructure, and chronic underfunding were critical issues. And those are the areas that we continue to advocate for key investments to be made. So certainly coming out, as we're at this stage of the pandemic, the discussions with governments, both at the federal and provincial level, have continued to grow and develop. And we're seeing a level of awareness amongst the Canadian public about the issues in long-term care that we've never seen before. Mm-hmm. So certainly for us, that's been incredibly positive to bring kind of focused energy and new opportunities for investment and partnership in long-term care that we've not seen in the past.
Do you take a position on whether the money from governments, and there is money to be had, there's lots of spending happening, as you say, should go to private care homes or for profit or not for profit? Does it matter, in other words, in the quality of the care we wind up with?
Yeah, so certainly our position is that, all types of long-term care homes were affected during the pandemic. We need everyone contributing. We need all hands on deck, if we can use that expression, for the future that we face with the needs in long-term care. When we look at sort of the Canadian landscape of who is providing long-term care services, we can see that 46% of homes in Canada are already publicly operated and owned by largely provincial governments, and only 29% are private for-profit homes. So really, we believe strongly that our focus needs to be on some of these critical topics. Certainly the one that is top of mind for everyone and is, raising a real question about the sustainability of long-term care is recruitment and retention.
When we look at the census data, it does show we want to stay in our homes a long time, and elderly people stay at home as long as they can into their 70s. It suggests that when you're headed to a long-term care home, it's because your needs are very great. In other words, they're kind of quasi-hospital settings. Do we treat them as such? Is the funding and staffing sufficient if we consider that really what you're talking about is extensive medical support?
Mm-hmm. Well, certainly we consider long-term care homes to be an environment where people's care needs can be met, but also we're a home environment for the residents who live there. And so we certainly aspire to be a bit of a crossroads on those two. But, we have suffered from chronic underfunding and have struggled to kind of meet the needs of residents, especially when we look at the issues around aged infrastructure, mm-hmm. Which we know played a factor in infection prevention and control efforts that were made throughout the pandemic. And so that is an area where there is significant need for investment. And there are some barriers to accessing capital financing for long-term care as it relates to kind of risk considerations and insurance that's no longer types of insurance that's no longer available to long-term care homes. So we do need government support and potentially Canadian Mortgage Housing Corporation to play a bigger role in supporting long-term care development, both for new bed development and modernization.
Jodi, so good to have you for this. Really appreciate it.
Thank you so much.
Jodi Hall is CEO of the Canadian Association for Long-Term Care. Well, it seems the majority of Canadians, when asked, say they'd rather stay in their own home than go into care. But those same Canadians have very few of the financial means to do that. The federal government recently charged a task force with reviewing how it might support seniors, and that includes the possibility of a new benefit to help cover the costs of aging in place. Bob Bell is former Deputy Minister of Health and Long-Term Care in Ontario and a former CEO of the University Health Network and working on aging in place in Canada. Bob, great to have you with us.
Hi, Amanda. It's good to be here.
I do want to start there. There's new focus on this. We know people like the idea of staying at home. Do you think an aging in place benefit is a good idea, one that the Fed should get behind?
Well, I'm going to modify that a tiny bit to say it needs to be aging in the right place. And of course, that benefit will help to develop the right place. We think that today across Canada, there are lots of folks who are moving into what we're terming naturally occurring retirement communities. In Ontario, and especially in urban Ontario, in Toronto, Ottawa, other urban centers, these tend to be in high-rise buildings across the financial spectrum, from Toronto community housing all the way up to high-cost condominiums that people are moving into as empty nesters. And we think that caring for seniors in the future needs to focus much more on the residences, the places where they're choosing to live, and how we can provide services better by understanding what these people need to age in the right place, how we can make it more the right place.
And of course, those NORCs, as the acronym goes, have been shown, as you say, they occur naturally. We see whole kind of pockets of people that happen to be the same age, probably have similar needs. Line that up with a subject you'd be very familiar with, and that's just a shortage of healthcare professionals, nurses, people that can support in the way that folks need, without us contemplating kind of any sort of neglect down the road where people are in their homes but not getting the support that they need, which would be the worst case scenario.
Well, let's look at how those health human resources, that's a very technical term for people providing compassionate care to folks generally over the age of 75. Let's look at how they're lined up right now against where people live. And you might have a high-rise building that has 50 or 60 seniors in there. And the typical way we provide community service, home care services now is to have 6 or 7 different agencies sending 14 or 15 people in to serve their individual clients. What we're looking at is the opportunity to say, let's provide a contract for one agency to have maybe 6 or 7 of the same workers in that building every day. Rather than going between buildings, rather than spending a third of their time in transit, they can develop relationships with the people in that building and provide much more cost-effective care by focusing on where seniors are living.
And of course, give seniors what they want, Bob, which is to stay in those homes that they've been in for so long. Do you see a new emphasis on this? This has been a subject of discussion for some time, years now. Do you see governments now embracing this idea of kind of a multifaceted approach to where we house seniors?
Well, I think we need research to understand two things. First of all, what are the potential benefits? I think they're relatively obvious with technology development. How do we support seniors remotely in these buildings with service delivery changes, as I've described? It seems obvious that these kinds of building opportunities are aging in the right place. The question then becomes, how can government support this through perhaps tax considerations for landlords, through the ability to provide tax benefits to the residents, to invest in technology assist that will help them stay in the same place they're in currently. And remember, Amanda, we're not talking in any way about eliminating long-term care, retirement homes or nursing homes. But even if we can simply delay the need to move into a long-term care setting by 6 months, that's an enormous increase in the sustainability of publicly funded healthcare in Canada.
I've got to ask you, a lot of attention has been paid because of the vulnerability of seniors in those settings during pandemic, and a lot of focus on what need to change. Are you optimistic that those changes are being made, or do you think that people in long-term care settings and elsewhere are safer today, if I can put it that way, than they were a couple of years ago?
Well, no question. I mean, if the pandemic were to start today, God forbid it hasn't ended the last one, but if there were a new challenge similar to what we've been facing, there's no questions. Lessons learned over the last 2.5 years would stand us in better stead than where we started from. But I think one of the things that we've discovered is that home is a safe place to be. You know, the risk of infection from home care was much less than the risk of infection from long-term care. So people, even if they're in the same high-rise building, by having control over their own apartment, by having the ability to control who's coming in and out of that apartment, it's a much safer environment than people being in long-term care, when there is a communicable disease like we've been facing in the air and the environment.
Bob, so good to have you. Appreciate your time.
Thanks so much, Amanda. Cheers. Bob
Bell is the former Ontario Deputy Minister of Health and Long-Term Care. Coming up, we all know we need to save for retirement, but how much is enough? Stay with us.